All right, we're back. It's no slouch, no ouch. My name's Alex.
My name's Mason.
And we're talking strengthening today. Flex. So we're going to talk about strengthening exercises today. And this is, again, one of those big components into resolving pain and discomfort when you're at your desk. So the goal is that we're applying some extra force to different muscles. And by applying this force, we're encouraging them to adapt to get more used to dealing with those forces. A lot of times when we're sitting around or sitting at our desk, we tend to be a little bit more sedentary. Sometimes we're not up and moving as much as we should, and our muscles kind of get used to having a little bit lower pressure on them, and that can result in some weakness that then becomes some more of a motor control issue or a disconnect between the functioning of those muscles. Right. So with that, the dosage is a little bit different. We generally do about 2 to 3 sets, and we're going to do somewhere between 8 and 12 reps, and try to find something that's a little bit more challenging to do. We're going to change it a little bit from what we normally do, a full minute of exercises, but we'll do several sets of these exercises.
Because that's geared more towards motor control, that high reps, high time. Yep. Retraining our brain. That's
reprogramming.
And there's a few different ways you can do this strengthening stuff. There's isometrics, which is just a big fancy term for holding a muscle contraction at a certain point. So if Alex is trying to push into the table, his hands aren't going to move. That's kind of isometrics in a nutshell. You're holding something, holding the force, but my hand's not moving up. Kind of the opposite of that would be isotonics, which is the muscle contracts and you're moving. So just like that, you're trying to hold a contraction with, let's say, our bicep, and you just let your hand come up while you're doing it. And you can hold a weight, a dumbbell, a TheraBand, something along those lines. Yeah. Should we talk about some precautions?
We should. And I think some things to kind of keep in mind is one of the biggest ones, and I'm guilty of this.
Okay.
I forget to breathe.
Oh, yeah. It's not good if I do that.
You're trying to, really get in some good reps at the gym or at the desk, and I just forget to breathe. And that's one of the things that you really want to focus on. So normally the rule is whenever you're putting workout, so let's say if I'm doing a dumbbell raise and I'm moving this way, I want to exhale when I'm doing the lift. So, and then breathe when you're relaxing or going back to reset. And that's kind of, we'll talk about that a little bit in the videos as we're going, and we'll cue you into where we expect breathing to occur. Yeah. But just mainly, if anything, just make sure you breathe.
Yeah, breathing. The other important point there is to don't jump into something too quick.
Yep.
Because what I mean by that is don't decide to lift 380 pounds when you should only be lifting 20, because you're going to really, really hurt the next day and tear more muscle fibers than what we want. Because there's an optimal point of adapting the muscle a little bit at a time instead of just trying to do way too much and then having this buildup of lactic acid and all these other cell components just making you really, really sore.
Right.
And which shows up, 24, 48 hours later?
Yep. What we call the DOMS,
or
delayed onset muscle soreness. Fortunately, most of these exercises that we're doing are fairly low level, or like we're not going to be cranking 300 some pounds off the floor or something like that. These are going to be fairly attainable, but we do still want to get some of that muscle soreness within the next couple of days, and you may feel that within the first week.
Which is fine as long as it's
normal.
Super painful. I mean, if you're going to be sore from starting out, and that's fine. That's normal. It's just your body's way of telling you, hey, we're changing something. We're doing something more than we're used to.
Exactly. You want to touch on dumbbells and resistance bands?
Oh, sure. So we talked about that a little bit already with the bicep curls. So there's a couple different ways. So a dumbbell is just kind of a hunk of metal that's a certain weight, and that's going to give you the same weight throughout your range of motion. Generally, and that's a good way to start. They're cheap, easy to find. You can find them through Amazon. Go to your local gym if you want to work out there. The other thing you can do is find TheraBands or just resistance bands. That's the more common name. But those are another one which will actually change some of the resistance through the motion. We really like those in PT world. That's something we use every day. But yeah, again, those are easy to find. You can find them on Amazon or go to a gym, use resistance bands
Right.
there.
Most department stores have some variation of them. And the nice thing about those, both dumbbells or resistance bands, is that you can kind of keep them in your office too.
Right.
So,
And there's a great variety of resistances
Right.
within dumbbells or TheraBands. So you can get
Exactly.
something super hard or something super easy, depending on what you do.
So one final thing to consider with strengthening is just with stretching, just with anything that we're doing, this shouldn't be causing more pain. And so if any of the exercises that you're doing are causing pain or making existing pain worse, stop. We don't want to continue doing it. Do the things that feel good. If pain continues to stick around, that's time to maybe go see your physical therapist or a physician, just to verify that
Nothing's going on.
Right, nothing else is going on, and that maybe it's something not just muscle related or posture related. With that being said, though, again, don't work into pain. Pain is not. This isn't a no pain, no gain type situation. We want to work in a comfortable range. You're going to feel sore, but that's all we're looking for.
Right. And with that, I think we're going into our shorter videos. Remember to hit the subscribe button, and we will see you in the videos with some strengthening exercises.